the DC Healthcare Coalition, a group that was formed to save the nation's capital only public hospital. We're now a watchdog group over public health issues. I greet you in the name of peace. I want to talk about an issue that affects every one of us, healthcare. Now, healthcare should be about universal access to quality care that prioritizes people over profit, but it's not. I want to tell you about healthcare in Washington, D.C. I want to tell you about the closure of the nation's capital only public hospital, D.C. General. The promise by city officials is that the closure would save money by closing the hospital, but the opposite is true. D.C. now spends more money on health care to serve fewer people. D.C. General closed 10 years ago, and the effects are still being felt, especially by the most vulnerable residents of D.C. I want to tell you about the closure of D.C.'s public mental health clinics. Again, the promise was to save money by privatizing. Instead, the result is that the most vulnerable mental health patients are not being served by the private clinics, and homelessness has increased as a result. And lastly, another stupid healthcare idea is to get rid of doctors at the city's youth detention centers. It's precisely because of unmet medical needs that many of these youth are in jail. So DC government claims it will save money by getting rid of the doctors. What about the value of saving a child's life? Always the promise by DC government that cutting healthcare services will save money and improve services, but it never does. So I want to